This video is for lash lift and brow lamination, and we're starting this video as if we just got to work. So the first thing that we do when we get to work is wash our hands. We go to the sink, we wet our hands, and we get a coin-sized amount of liquid hand soap, and we wash our hands down to our wrists. We wash the back of our hands down to our wrists. We wash our fingers, and we wash the backs of our fingers. We wash our fingertips and our nails. We wash between our fingers. We wash between our fingers and our thumbs. We wash our thumbs and we wash our wrists. And we do all of that interlocking washing for a minimum of 20 to 30 seconds. Then we rinse everything thoroughly under the sink. When we feel like our hands are properly rinsed, we're gonna grab some disposable paper towels or a towel, turn the faucet off, dry our hands off, throw the paper towels in the trash. If it was the towel, it's now dirty and it goes in a closed container until it's time to do laundry. And then we get the hand sanitizer that is 70% ethyl alcohol, and we sanitize our hands. Once everything is thoroughly sanitized, we can prepare our room and station for our clients that are coming in for a lash lift and brow lamination. So what we want to do to start is we want to disinfect our workstation, bed, and equipment using a disinfectant wipe and following manufacturer's instructions. We're going to check our equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We'll dispense products needed for the service. We will be doing all of this because you want to do everything that you possibly can before your client arrives so that you can stay on time with your appointments. You're being respectful of their schedule and yours. It's just a very professional way to be, so you do not want to waste time by waiting until they get there and talking about the service before you set up for the service. So this is how you would dispense your products ahead of time. You would prepare disposable portion cups for each product with a portion of product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula. You'll close the lid to the product and set the portion cup tray on the tray. You will drape the facial bed using one fitted sheet, one flat sheet, and 3 towels. Place clean laundered sheets down on a disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel, along with a roll towel to support the head and neck of the client. Save the third towel to lay across the client décolleté, or you can use disposable table paper. We are using the sheets with the facial bed and the blanket with the towel horizontal at the top of the bed, of course. But let's take a peek at the tray that I have set up ahead of time for this service so that we can just plug along when the client comes in. So I have cotton rounds, I have 2 squares and 4 squares. Of course I have disposable gloves because you wear gloves for this service. Water, always have water. I have a barrier cream, something like Vaseline that you would be using to place around the eye area and under the brow. So you're gonna put disposable eye pads on. The barrier cream will help hold those on as well. I have wooden stick Q-tips here. I have some disposable mascara wands here. I have different size rods for my lash lift, and then a tool and adhesive that will be bonding my lashes to the rod. Then I will be using different brushes because I have makeup remover, I have my lash lifting lotion, I have my setting lotion, and then that would be for brow as well for the lamination steps. And then of course I have my wax for my brow lamination. And then I have the tools, the Y comb, and the tools to apply the different products that are set different than those brushes for the brow lamination, of course. So I've got everything that I need for those services, and then some. And then I'll put that out of the way so that you know that I am prepared and ready for my client even before my client comes for the appointment. Of course, I will be following manufacturer's directions. If there's anything that needs an update, I would be changing it. But I've got the bulk of the work out of the way, and certainly the room disinfected and ready for my client when she arrives. So now it would be time to do your client consultation. You're waiting for the client to arrive. So what you want to note is, of course, you're going to walk to the client with clean hands. I would never do that to greet my client with dirty hands. I'm also going to clean them again before we start the service. But I just always like to note that in case you have client after client after client. Obviously, when you finish, you'll see that the last thing that we do is wash our hands as well. So even if you had to go greet a client after you've prepared the room and everything has been sanitized and disinfected, you'll be able to go again with clean hands to greet the new client. So we'll go and meet our client and escort them to the work area. We're going to assess the client's current style, and we're going to determine the client's preferences as well as assessing the client's needs. One thing to note is this service, both these services actually, like the lash lift, you would have some communication prior to them coming about what they can do post-service. For example, the lashes, they might not be able to get wet for 48 hours or apply any makeup, etc. So you need to make sure that your client is aware of this. Nobody wants to pay for a service and then get home and do something and then the service is completely ruined. Nobody. So you have that proper communication with your client ahead of time, and you're going to retouch on it right here that to make sure they remember what they can and cannot do when they leave, if they want the service to last. So this is not a service that somebody books for the night before a party, because they can't wear any makeup or do what they want to do for their party. So they need to do it a few days, 3 or 4 days before. So then you're going to assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. You will assess the client's consultation form for any medications and products used within the last 72 hours and consult on any known allergies. You'll consult with the client on any facial surgeries within the last 3 months, and if the client's under a physician's care. You'll assess if the client is prone to cold sores or fever blisters. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. You will assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. And if the client is free from the above contraindications, you can move forward with the procedure. So all of that stuff needs to be taken very seriously, because all of that can affect their skin and the areas around their eyes and brows. You are their esthetician and their skincare expert. So it's so important, if they have certain allergies, that you're looking at the products that you're using to check and make sure there's none of those things they're allergic to in your product. All of that just takes a little extra time. Just make sure that you're mindful of that, because you really want to be the professional that does the best service and with the most care. So client's needs come first. That being said, we're going to get our client comfortable. She does not have to disrobe for this service because it's on her brow and lash. You're just going to simply get her comfortable in the facial bed. So she's going to lie down in the facial bed on that towel's horizontal, and we're going to get her a little bit more comfortable. We're going to put this rolled towel up under her neck. We're going to take our hairnet to keep the hair out of her face and brow area and lash area. And we've got this extra towel here, and I'm just going to drape it over her shoulders and neck to cover up, just to make sure. And I'm checking in, of course, that she's comfortable, and she is, which is great. So the first thing that we're going to do before we can start the service again is wash our hands and put on gloves. So we're going to go back to the sink and wet our hands, find that coin-sized amount of liquid hand soap, and we're going to wash our hands down to our wrist. We're going to wash the back of our hands down to our wrist. We're going to wash our fingers, and we're going to wash the backs of our fingers. We're going to wash our fingertips and our nails, and we're going to wash between our fingers. We're going to wash between our fingers and our thumbs. You're going to wash our thumbs, and we're going to wash our wrists, and we're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. Once you feel like you've gotten a proper wash, it's time to properly rinse. So you're going to get under that water, really do a good rinse. And when your hands are rinsed, you're going to find disposable paper towels or a clean towel. Turn the faucet off. Dry your hands thoroughly. Paper towels can go in the trash. If it's now a dirty towel, it just goes into a closed container until it's time to do laundry. Then you're going to get your hand sanitizer, 70% ethyl alcohol. Sanitize those hands and make sure you get everything dry because you've got to put your gloves on now. So you are grabbing your disposable gloves, putting them on, and once they're on, you'll be good to go. So the first thing to do to be able to start this service is you have to clean the brow and clean the eye of any makeup, oil, residue, etc. So that's the first thing that we're going to do. We're going to put some makeup remover on some cotton rounds, place it on her eyes, and then we'll go ahead and do the brow while that's resting there. Anytime you're working around the eye area, we're always really delicate and careful. We don't want anything going in the eye. And so we're going to go ahead and remove any product on the brow. So I'm just working in the direction of the brow and then coming back, so you can go in both directions. You just want to make sure you get it nice and clean. And just takes a minute to do that. And some people come in with makeup and some people don't. Even if they don't, you're going to do this cleansing step because there could be sunscreen, oil, sebum, anything that would interfere with the service. You don't want that to happen, so you're going to go ahead and clean it. And then some people will come in makeup because they can't wear it from this point on, or they're coming straight from work or something, and you just need to take the time to remove it. Whatever that looks like, whatever that means, it's okay. And then I'm going to dry everything off really good as well, which you would want to do that too, but I'm doing it for a couple reasons. One of the reasons I need to dry her off is because I'm using a mannequin, and I'm going to be applying, this is not in the video, or this would not be in the service, I'm going to be applying some double-sided tape to her eyelid so the rod will adhere so that I can actually do this service for video's sake, as far as at least I can do it, you know. On a mannequin, but it does allow the rod to stay on. You would never do that for a person, so I'm going to I've taken my gloves off the last 2 times to try to put the double-sided tape on. Let me see if I can do it with the glove on. Maybe I can. Oh, I can. Good. So I'm going to stick some double-sided tape to her lid. Obviously you would not do this. You would actually use a little bit of the lash glue like the bonding agent that we use to get the lashes to stick to the rod. That's what goes on a human's lid, and I'll go through that in just a second. I just needed to apply this so that when we get to that step now, which is coming right on up, this rod will actually stick to my mannequin. And this is a way I found to make that happen. And even if it's not perfect, it'll stick a little bit. And that just makes me happy. So for being able to show what the service is really like, it's kind of nice to be able to do this. So I'm hoping that it will not stick right now. Okay. Just don't want the lashes to stick to the double-sided tape. Okay, so what you would do is you would be grabbing this, but let's talk about the underneath first because we have to protect her. So we've got our barrier cream that we're going to put underneath the eye, and I'm going to put a little bit all the way across because I'm going to be putting those disposable eye pads on, and this barrier cream helps them adhere a little bit better too, which is nice. But you're going to want to protect that under eye area, and I'm going to put a teensy tiny bit under the brow as well. Not much, but just enough. And I'm going to put it on both sides, and then I'm going to put the iPads on. Now, one thing to note about the iPad, under iPad, is that you're going to take it and cover up the lower lashes with it. You're going to take it all the way up to the top of that lower lash area because you are not lifting the lower lashes. So you are going to take your iPad and you're going to slide it up and get it as close to those top lashes as you can, covering up the low lash. And then I'm just going to lightly press it in to that barrier cream so that it'll stick a little bit there and just stay out of the way while we work. Completely covering up the lower lash line. And anytime we're working around the eye area, we just take our time and we're just very precise and delicate, and that's what we do. And then I'm checking in with my client. Are you okay? If everything feel okay? Okay, good. Making sure you're doing things the way that you would want them to be done for yourself. And then we're going to measure rods, which I'm going to be using like a medium one, and I'm going to apply it, and hopefully it will stick to my double sticky tape. This is where you would be taking a drop or two of this bonding agent, what we get the lashes to stick to the rod with. You would put that, a couple drops of that on her skin, and then you would place the rod down on that, and you would get it close to the lash line, and you would hold it down for about 5 to 10 seconds. Which is exactly what I'm going to do to try to see if this rod will adhere to my little double-sided tape that I've got right here. So I'm going to press and see how we fare. And if I'm lucky, it'll get us through this video. Fingers crossed. Other side. Also trying to get it close to the lash line. And then I'm going to do that little 5 to 10 second press. Gentle press to try to get it to adhere. So I would be, on a human, I would be getting it to adhere to their lid just temporarily because it comes right off with water. Here I'm just trying to get it to stick to that tape so that I could then lift the lashes. And then I'm going to get my little rod here to my little tool so that I can apply this adhesive and get the lashes to hopefully stay to the rod. And I'm just going to take my time as I work because how they stick to the rod is how they're going to lift. So I want them to be nice and separate and lifting in the direction that I want them to lift, all the things that matter. And hopefully that will be the case. And it may take a little bit of time for this to happen, so you just have to be patient. And this is a very precise and technical step-by-step service, and you just work your way through each of the steps. So as I'm applying my lashes to the rod, I'll be separating them so they're not clumping. I'll be looking to make sure that they're not going sideways. I would want them to go straight up. She has a shorter lash, so I really want them to look nice as they are adhering, because however they look as they adhere to this rod is how they're going to look when they're lifted. So if they don't look good now, they're not going to look good from this point on. So this is where I am going to be a little bit more, I would say, meticulous in my placement of the lashes, because this is where I want to see what I'm going to see when it's all said and done. And if you feel like something's not right or in the right position, you can take a little microfiber tool with a little bit of water and then dampen it, because it will release that glue from the rod, and you could straighten it back out then. And then just re-adhere it. So this is where you want to make sure they look exactly how you, as the artist, want, an esthetician, want them to look. So if I feel like anything looks too clunky or lunky, that would be where I'm going to go back in and fix it. It would be now, because then there's no, after now, there's no fixing. It will look as it looks. I think I said in the last video the iPad wouldn't be, it moved one time on the last video too, and that is because for my videos I've reused them so they don't adhere like they're supposed to be. You would never reuse an iPad. It's disposable, it goes in the trash. So I'll move forward with this. I don't want to like hedge my bets and really have it all come off. So we'll go ahead and go to the other side, which is already coming off the tape. Maybe by me working on it and the lashes going on it, it will stick a little bit to get through at least the process of what we're doing here, which is interesting. I really do like this service as an artist. I think it makes a woman's eyes look even more spectacular than they already are. Just opens them up, makes them look a little bit more lifted and well rested. Brings the focus to the top of the eye, which is always nice, but like to have that lift. And it's your own lashes, which is even greater. That it's you and not anything artificial. It's just the best you could press forward with. It's one of those things that I think is great, is that when it's just really you. It's like the best of you. Last little bit here to adhere. So after the lashes have been bonded to that rod, you're going to get to apply your lash lifting lotion, and you're going to do that, and you're going to start at the root of the lash, and then you're going to work upward. And you want to do that until you get about 3/4 of the way up, and you're going to stop there. You do not want to go to the very end of the lash. You want to start at the root and take it up, because that's the weakest part of the lash. It's the part of the lash that's getting ready to come off, and it's a little bit more delicate. You really want to concentrate the lift at the base and then halfway, 3/4 of the way up. So we're going to do that and apply it in that lifting direction and only go from the base to 3/4 up. So we're just being very mindful of that. Don't want anything to look dry or dehydrated or burnt. We're just going to be real kind. So we're going to go to the other side and do exactly the same thing. Starting at the base, working our way up with this lash lift lotion, and we're applying it. And I'm also going to check in with my client at this point, checking in on their comfort level, because when you put the lifting solution on, it does have you can have a smell sometimes, which they'll smell, and then it may be a little tingly, which is totally normal, and you want to let them know that if this is their first time. Just what the expectations are, etc., and that it's normal if it is tingling. Okay, and so right now I'm going to give her some comfort and some cover. So we're just going to we're going to go over manufacturer's recommendation, but we're going to cover up those eyes, do a little towel cover so she can breathe here, and we're going to review how long it should stay on. So you would expect we're going to say anywhere from 5 to 10 minutes. Would this, based on manufacturer's recommendation, would this lash lift lotion stay on? So what we're going to do now is move forward through the process of the video. We're not going to sit here for 5 to 10 minutes, but we would just note that that time has elapsed for the lash lifting product to process. So we're going to go ahead and remove the towel and then remove the cotton rounds. And we're going to do a dry remove first. So I'm just going to take one of my rounds and I'm going to do a gentle press to remove that lifting lotion. And you can do as many passes or sweeps as you need, maybe 2 to 3. I'm going to do a gentle press with this first dry. And then I'm going to do a very gentle damp remove as well. So let me do the other side. Dry first. And then we'll do a damp. We're always cautious with every service. We are even extra cautious with eye services. Now we're going to do damp. A little gentle damp remove. On both sides. And then we are going to go in with the setting lotion. So I'm going to use a different brush and I'm going to apply it exactly as I applied the lifting lotion. I'm going to start at the root and work my way up. And it's okay if this one gets a little bit higher. It's basically like your neutralizing lotion, but you really can kind of think of just exactly the same. That base to the 3/4 is where you want this setting lotion to go. So I'm just being conscientious. I could have used one of those little microfiber brushes too. I just happen to have these brushes, so that's what I'm using to show you a differentiation between the lash lift and the brow lamination. And then I'm going to go to the other side with my setting lotion. Once again, I'm applying it to those same places as my original lifting lotion on the lashes. And then I'm going to give her that same little break. And we are going to now review. It would sit, based on your manufacturer's directions, we're going to say 5 minutes. So once that 5-minute window has passed, you can then take it all off. So because for the sake of the video, we're not going to sit here for 5 minutes, but just imagine that 5 minutes has passed. And then we're going to go ahead and remove the cotton rounds and the towel. And I'm going to do a dry remove with this as well, very gently taking off the setting lotion. So I'm going to do that dry, press, and remove. I'm going to do the other side as well. Once again, gently removing. And then we're going to go in damp. And you're probably going to see as you go in damp, some of the lashes separate from the rod, as they should, because you're going to use water to do that after you get this off. So if that starts to happen to you and you see it, that's perfect. And you can just easily let them separate, because you're going to be coming back in and getting any that don't come off with this anyway, with like a little Q-tip. And what basically water just not only removes product, but it allows that bonding adhesive to release. That's one of the ways that you get it to remove from your client's lid, as well as the lashes from the rod. So just a little bit of a gentle water pass, and then I'm going to get a clean one of these before we go to the other side. So I still have some lashes that are bonded with the rod, but not many. So I'm going to go to the other side first to get that damp rinse on that side as well. That damp remove. Once again, if I see those lashes coming off, I don't even worry about it, because I know that's what's going to happen in a minute when I'm removing, which is what I'm getting ready to do anyway. So it's all perfectly part of it, perfectly appropriate and part of it. And some of the lashes may continue to adhere, and that's okay too, because you'll go in with that wooden stick Q-tip in just a minute. This one came off really easily. So I'm just going to grab a little Q-tip damp with some water to finalize this removal of some of these lashes over here. There we go, easy peasy. Anything that's still stuck to the rod. And I'm going to remove both the rod and the disposable under eye pad at the same time, because that's going to go in the trash, and then the rod is going to come off to be disinfected. And I'm going to see if I can go ahead and get my pieces of tape off, because y'all don't need to even deal with that. And it's perfect. And then what we've realized in some other videos, let me try a 4 square first. If I use a 4 square, it seems to have gotten some of this yuck that stays on these lashes, because they're not real lashes, from the cholesterol that I'm using and that glue. Yeah, that worked great this time, much better. We figured out how to quickly remove some of this debris that has been lingering in the lashes, that's been taking me like eons to get off the poor client. So let me just also do a gentle comb through with a mascara wand to make sure that any extras are gone. Oh yeah, that worked 10 million times better. And then I'm going to go to the other side. And I am going to get a little wooden stick Q-tip wet. I think I pretty much got all the lashes off, but just in case, off the rod. So the rod is now easily coming off because there's no lashes stuck to it. So I'm going to slide this disposable iPad off to be thrown away, and I'm going to take off my rod. Ooh, look, that's still stuck to me. To be disinfected, and then I'm going to take off my stickers that you normally wouldn't have on there for a client in any way, shape, or form. Just a simple mannequin trick here. And then I'm going to do my 4 square again, where I'm trying to remove any of this extra debris from the lashes. Hopefully it'll work nicely like it did on the other side, and if it doesn't, that's okay, we'll get it off. Not bad. Not too bad. Which you wouldn't have to do this for a client either, because that wouldn't happen. You wouldn't have cholesterol and it connecting with this bonding. And then I'm going to take my mascara wand and do a nice comb through. So nice. Much better. Much easier. Much easier. And now we can go ahead and move forward to our brow lamination, because that one's so much smoother. So with our brow lamination, the area's already been prepared. We have cleansed it. We put a little bit of that barrier cream. And so basically what we want to do is go through what the processes would be to get it into that same concept as far as a lift goes for the brow. And what you would want to do is you would want to grab a bonding agent and a Y comb. And the first thing you're going to do is comb through the brow, and you're going to comb it up and out in the position that you want it to be, like we did for the lash that we applied to the rod. And then we would little by little apply the bonding agent and then comb with our little Y comb the brow into the exact position like we did with the lashes on the rod until we got it to where we want it to stay. So this is going to be tedious, and it's also going to take that time to comb through and add a little bit of the bond at the same time, and literally taking the time like we did with the lash lift on both brows. So you would stop, you would put on a little bit of bonder, you would comb it until this side is complete, and then you would go to the other brow and you would start with the comb up in the direction, kind of up and out, that the style is that you're trying to create for the client. And some clients, of course, the reason they're coming in is because they have coarser brow. It's going all kinds of different directions, and this is what helps. The bonding agent is what helps it stay in place. So then you put a little bit of that bonding agent on, and then you comb it in the direction that you want it to stay. And you work all the way down and out. And you continue. Once again, you add some of the bonding agent. And remember, you don't want it to cross. You don't want it to be stuck in the wrong direction, because remember, however the bonding agent and your combing place it, once you put that perming solution on, it is going to be it that way. So you finish both sides, and then I'm going to get my little microfiber tool here to apply my perming solution, and I'm going to comb it in the direction of the brow that I just bonded, the way that I bonded it, and I'm going to do the same thing where I start at the base of the brow and I'm going to take it 3/4 of the way up and then stop there. Once again, that weakest part of the brow is that very tip of it. So we're going to, just like the lashes, so we're going to concentrate on the base and build it up and out with our little tool, combing it through. And this, once again, it's the same as with the lash. It just takes time and you work through it. It's a little bit more tedious, but that's okay. That's how you get the results. And you have tiny little tools to work with, so you'll make it look exactly the way you want it to look. And you'll do both sides. Once again, starting at the root and then working your way up and out. Going all the way out, but stopping at about 3/4 of the way out of the brow. Concentrating at the root, working your way up and out. Stopping that 3/4 way. And then once you've applied your perming solution, you will follow manufacturer's directions for how long you leave it on the brow. And here's just some suggestions from this manufacturer. So for a fine brow, you would keep it on 3 to 4 minutes. For a fine brow that's been tinted, you may want to keep it on 4 to 5 minutes. For a natural, healthy looking brow, 5 to 6 minutes. For a coarse, healthy, thick brow, maybe 6 to 7 minutes. And we're going to say that this particular brow is a fine and tinted brow. So we would want to leave it on for 4 to 5 minutes. And then we're going to remove this perming or waving solution. So we're going to get a dry remove first. Now, we are going to assume that it has been on for that 4 to 5 minute timeline. I'm just gently removing, and then we're going to go back with damp, and you can go as many times as you want to make sure that you have gotten it all the way off. I'm going to go with a damp next. Of course, we always avoid that eye area. We've just gotten our lash lift. We don't want to get any water anywhere on those lashes, which we won't. And we've removed all of that solution. So now we are going to apply the neutralizing lotion or solution. And we have another little microfiber, teensy microfiber brush to do that. So we're going to apply that. And we're going to apply it exactly how we applied the perming solution to the brow, up and out. And you're just being very conscientious. The same thing you did on the other side, you're doing with this side. And then you'll go to the other side doing the same thing. Let me just comb through here because he's looking a little crazy. Not really sure. Okay. And we're applying it the same direction, the same way, the same thing for this neutralizing lotion. And that is on, and then you would go over those manufacturer's directions for how long you would leave that on. So for our very fine brows or those fine tinted brows, they suggest 5 minutes. For the natural healthy or even that coarse healthy brow, 6 minutes. So we are the fine tinted, so we're gonna say 5 minutes, and we're gonna pretend as if 5 minutes has elapsed, which means that we're gonna wipe off dry, and then we're gonna go back with a damp. Starting with that dry remove, gently, and then we're going to get a damp remove so we can get all of that solution off. And then, remember, you can do your passes, you can do more than one if you feel like you need more. You still have product on there that you're trying to get off. Like whatever it takes, you have the eye to figure out what you need to do. And then what I'm going to do is, just a minute here, we're going to put on a nice little wax, like sheen. We are going to comb, take like a brow brush here. We're going to pretend like this is a brow brush. And we are going to comb through our brows nicely in the position that we want them to hold, of course, that we've been working on with them, that up and out. And then we are going to apply our beautiful wax sheen to it. So we are going to get that last product on. And I'm just going to use another final microfiber here, and we're going to comb some nice little shiny wax through it so that it looks gorgeous. We will be communicating with them that this is something that they will want to brush their brows daily. They will be easier to work with and certainly look amazing, but you will have to still brush them. They're not going to stick in this position and not move ever. So that's something that people may not realize, but you do need to comb your brows after brow lamination on a daily basis so that you're combing them up and out the way that you want them to look. Their hair, like anything else, so they can shift around. And then you would present that gorgeous look to your client with the mirror, and they're just going to be like over the moon because it's like super beautiful and pretty and perfect, and they will be like jumping up for joy to get to come back in and see you. So the nice thing about this service is they don't have to disrobe for it. So you would simply remove the towel and the hairnet and help them get up, out. It might, with a lash lift and brows and anything, you've had your eyes closed for a long time, so it may take a minute for them to adjust before they get up, and then you can give them some privacy. You're going to take off your disposable gloves, and then when they're ready, they can come meet you out in the client waiting area. So I'm just going to take off my disposable gloves, and we'll finish up. So you would just be reminding them and following up about the specifics with these services with aftercare and maintenance. For example, lashes maybe not be able to get it wet for 48 hours or wear makeup. So you just need to review the protocols. If they want to pay for this service and they want it to last, they're going to want to know what they need to do. And then you'll get them booked because they want to continue to have the service in the recommended amount of time to have it done again. And you'll get them checked out, which you've done. So then you need to get ready for your next client. You need to get back to your room. And if you have any single-use items that need to be discarded, now would be the time to do it if you hadn't already discarded them, like those under-eye pads or the little tiny microfiber brushes that are disposable. Any single-use item, trash it now. You would also get all those implements, like the brushes and the tools that you use for the bonding agent. They would go in a closed container labeled to be disinfected. You're going to take the sheets and the towels and the bedding and place it in a closed container until it's time for laundry. And then you're going to identify a proper cleansing agent and read and manufacturer's directions so that you can follow manufacturer's directions for mixing and usage to wipe down your workstation and area and cleaning solution with the cleaning solution to remove any debris. Then you're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting, which also means that you're going to need to put on a new pair of disposable gloves. You will follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You will disinfect electrical equipment. You'll store it in a clean area separate from other implements. And then and only then can you remove those gloves and throw them in the trash. It would be time for your final hand wash, so you're going to go to the sink. You are going to wet your hands, find that coin-sized amount of liquid hand soap, and you're going to wash your hands down to your wrists. You're going to wash the back of your hands down to your wrists. You're going to wash your fingers, and you're going to wash the back of your fingers. You're going to wash your fingertips and your nails. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs. You're going to wash your wrists. And you're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. Once everything is washed, you can rinse thoroughly underneath the sink. Once you feel like you've gotten a proper rinse, you're going to grab disposable paper towels or a clean towel, turn off the faucet. Dry your hands off completely. If it's disposable paper towels, they go in the trash. If it's a clean towel, it's now dirty, and it would go in that closed container with the other dirty towels and linens until it's time to do the laundry. Then you can find your 70% ethyl alcohol hand sanitizer. Use it. Thoroughly sanitize your hands. And once your hands have been completely sanitized, you can then set up for your next appointment. So that concludes your lash lift and brow lamination video.